Dr. Anthony Fauci, who is the leading health expert on coronavirus. He said, if you are vaccinated and you're outside, put aside your mask. And that was again a question into what can fully vaccinated people do when it comes to the mask. So my first question to you is, there's a lot of debate about where to take the mask off and how to take the mask off as well. Is this safe? Is it too early? People are still dying of the coronavirus every single day. Is it wise to take that mask off?
So first and foremost, I think the numbers are definitely on the downward trend, thankfully. Thankfully, with the coming weather, I think coming down on the numbers is always a good sign. With regarding the masking and the need to not wear the mask when you're on the outside is totally dependent upon where you are and what is considered as outside. So if you are out walking your dog and you're going to the park and you're doing it alone, I don't think having a mask on is required. On the other hand, if you are going to be outside, but eating, drinking, whatever, in close proximity to people around you where you do not know their vaccination status, I think it's maybe a little bit too fast to completely eliminate the mask. I think having a small group of vaccinated people together at an outdoor setting, I think is okay. Ventilation is the key. If you can have a well-ventilated outdoor space, I think having no mask is going to be okay. The studies really showed that the rate of transmission in an open outdoor setting is okay. Now, there are some studies that came along from Singapore, etc., where they said the word outdoors, but they may not really have been outdoors, where they have a higher rate of transmission. So I think outdoors, when it's really very well ventilated, I think it's still okay.
Right. Dr. Balani, last year also, when summer came around, we saw a decline in cases. People were able to get out more, and they were able to live somewhat of a normal life, even with the masks on and everything. But later in the fall, those numbers were changed. Do you think that could happen to us, where the summer we could be fine, but come fall, we have to close down again?
But there's a big difference between last summer and this summer. We have quite a few of our people here in population here who are now vaccinated,
right,
which wasn't the case the last time. So I think that is a very, very big factor in stating the need for unmasking, or you can unmask. I still feel that knowing your risk factors and knowing your loving family's risk factors is going to be important, because not everybody may have the same immune response to the vaccines. So if you are in that status where you are a solid organ transplant, you've got a kidney, you've got a heart, et cetera, or you're on chemotherapies, then I think you really have to be very prudent, because you may not have that same protection that that you would have had with or without the presence of the vaccine. So I think that is important. And then secondly, you're right. Am I concerned about the coming fall? Of course I am. I think we're all going to be concerned about COVID for the next couple of years. So having another wave coming in after this free-for-all kind of things over the summer, is that scary? It absolutely is scary, especially with those patients who are not vaccinated and or with increased virulence or increased variants that's coming around, which may have potentially an immune escape from the vaccine. I think those patients and those clusters that may come along is going to be a problem.
Right.
But again, to reiterate, right? So the open spaces is actually open ventilated spaces. You're really talking about good ventilation being the key in prevention of the spread.
Right. A lot of states, including yours and ours, Doctor, are reopening. They're reopening this month. They're opening up restaurants to full capacity. There's a lot going on. What do they need to watch out for while this reopening process begins?
So I think just being aware that, don't go, spreading around and laughing around and thinking that this is never going to, this is going to be the end of corona. I think that awareness that it may still happen, it may still cause infections, needs to be played in the mind. I think each one of us needs to be very well aware of our responsibility and being aware that the coronavirus is thankfully much, much better controlled at this point, but it's not gone away. So we do need to be careful that if there is anybody who's sick or unwell, I think staying away from those crowds, staying away from those indoor restaurants is going to be important. Being able to be open and communicating well amongst people regarding the risk of possibility of even a viral illness in them is going to be important. So self-isolating in those situations is going to be the key, and not spreading it out. So don't be the super spreader there, right? Yeah. So I think you just have to be a little bit more careful when you have all these activities open to the public.
Yeah, it's a lot on the people and how they kind of handle themselves, and only time will tell. Doctor, what about these variants and how are we seeing these vaccines against them? And especially I would like to know, what do you think of this Indian variant that's already now here in the United States?
So the current mRNA vaccines that we have a very good suppression of even these particular variants. So we do anticipate to have a good protection limits with these particular vaccines that we've had so far. If any vaccine is never 100%. The vaccine's efficacy is about 90 to 95%. There may be a slight drop in the amount of efficacy, but that efficacy is still very, very high. So I think we're happy to say that, at least we have a good coverage on these things. Regarding the New York vaccine, the variant, the Indian variant, which we have multiple mutants against certain escape strains, I think with the vaccines, one thing is for sure, vaccines is going to decrease your severity of illness. It's not going to prevent you from getting disease. So you still have to continue with your masking. You still have to continue with your protective gear and washing your hands and keeping your space. That's still got to continue, because the vaccines is not a prevention. It decreases, it mitigates your risk of having severe diseases, but it's still, you need to continue with your masking and keeping your hands clean and covering your cough and covering your sneezes, etc., appropriately, and washing hands all the time. So I think those things need to continue still.
Yeah, so these protocols, these key guidelines that we have been discussing for a year now, we have to continue following them. Just talking about vaccine, doctor, I have a couple of questions. One big news that came out this week on vaccines is the fact that Pfizer has been approved for 12 to 15 years old. Now, my question is, I understand that it's very important to vaccinate children in order to get any kind of herd immunity or to send kids back to school. But there are a lot of parents that are worried about the implications of this vaccine in the development of a child. What insight could you give us about that? How do we calm the parents down about this?
So I think I am very hopeful that many people will step forward and take it. I know I am giving my 15-year-old the vaccine as soon as she's going to be able to get the schedule next week, or whatever we can get it. We hope that the data from the pregnant data, where it is the CDC kind of put out the data on the pregnancies and the non-effects so far, again, it's still early. The mRNA vaccine really doesn't get into the host cell. So whenever we're talking about development delays or we're talking about negative outcomes that can occur, usually happens when a vaccine really integrates into the host DNA. This particular vaccine is an mRNA vaccine where it does that particular portion that is injected into you does not integrate into your cells. So given the fact that it does not integrate into your cells, it really does not cause permanent damage or an alteration that you would be concerned about. So I do feel that this particular vaccine is going to be safe for the children, even the young kids. even younger than 12. But again, they are going to be very, very safe, just there as they have been safe even for the fetus in the mother's womb. So I think it should be okay with these patients, with these particular population.
So do you see 2 to 12 also getting approved soon, doctor?
I don't know soon, but hopefully that's going to happen too down the road.
Definitely. You know, talking more about the vaccine, doctor, Johnson & Johnson has been, in discussion for a couple of weeks now. We're still getting some reports of this rare blood clots associated with the vaccine. There is some hesitancy that we have noticed in the public about Johnson & Johnson vaccine. What can you say about that?
So I think the most important thing is getting the vaccine. I think you need to step forward to get whatever vaccines available. The clot that was occurring with the vaccines usually occurred in the females. There were a few males also, but majority of them were in the younger females from 18 to 50, if I'm not mistaken, 18 to 50, where there was a rate of clotting that occurred. The rates of clotting factors that occurred was also very far and few. As compared to the billions of vaccines that have been given out, there have been only a handful of cases that have occurred. Not to say that it is a problem. I think it's very important that if you are in that particular age group, you have to be careful. You have to monitor your symptoms. If you get post-vaccine, you get a headache, you get a severe abdominal pain, you get easy bruising, etc., please let your doctor be aware of it. But having said that, that particular effect or side effect of the vaccine is far rare in its occurrence. So I think we should be rest assured that at least for other populations, non-18 to 50 years of women, I think it's still very, very good. It is actually very easy to give. It's a one-time dose. You don't have to come back again. So in population where we're talking about where the possibility of coming back for a second shot is a little dicey, I think having this particular vaccine in our armamentarium really is going to help with getting the herd immunity up.
Right. So basically you were saying if you get the vaccine, just get it, whichever one you find. That's the most important message. You know, this brings me to anti-vaxxers, doctor. There are millions of them here in this country that still don't want to get the vaccine for whatever reasons that they have. What do you say to those people? Because you are there in the hospital dealing with the COVID-19 crisis, you know, frontline, and then you see these people who don't want to take it.
So I think every human has a right to take or not take anything that they have been offered to you. I think it's important from us as educators to be able to educate as much as possible and pass the information as much as possible related to the particular drugs. Ultimately, it is an informed decision between the patient and the educator or the provider to be able to allay their fears. I think it's mostly allaying the fears that's most important in trying to get people who are hesitant to switch over to getting the vaccines. So I think it's most important to have everything out in black and white, be transparent in the education about it, the efficacy about it, the know-hows about that particular vaccine, and be able to answer the questions to your best of your knowledge. I think by extending that, we will hopefully be having more vaccine takers over the next few months.
Doctor, what's the worst case scenario if these anti-vaxxers don't get vaccinated and it's a couple million people in this country?
So everybody, every living organism to live in its world needs to survive, and it usually survives by trying to evade things that's going to kill it, right? So with viruses also, this particular virus tends to replicate very, very fast. And when it tends to replicate so fast, it makes errors. It makes errors in its replication. And every error in the replication is equal to a change in the genetic code, which can then portray and become a variant. There are many, many variants, there are many, many mutations, but not all mutations are significant. But there are some that are coming along that the more the virus floats around in the community, the higher the chances of it to replicate, and the higher the chances that we're going to be getting some particular replication mutation that is going to be of significance. And not only of significance, then of significance and harm. In harm, meaning that they may have a mutation that's going to escape the vaccine. So we've done all this effort of trying to vaccinate as many people as we can, but then you have this small proportion of people who will not get vaccinated, where you may get this particular infection that can then have a mutant strain that's going to evade the vaccine strains that we're going to be giving, which would then lead to more clusters of cases that are going to be then infectious and then pass it on further. So just like how we had the UK strain that came out that was so infectious, where the replication rate was so fast that you were able to infect much faster space. Same thing is going to happen with other mutations that may come along the down the stream if not everybody gets vaccinated. Yeah. So I think that's a risk.
It is so important to get this vaccine. So important. Just have two more questions left for you, Doctor, here. I'd like to know your comments on what's happening in India and how are you observing these numbers? And could that have an impact on us if they're not able to contain?
So it is very, very, very sad to see what's happening there. Thankfully, at least I think there's certain cities now. I have lots of friends in Maharashtra, and actually one of them just kind of texted in the morning saying, thankfully, things are a little bit better under control, a little bit stabilization. But again, India is a very vast country, and the resources and the supply and the demand of various healthcare products as well as healthcare providers is the main issue. It is sad to see so many not being able to get to medical help, not being able to get, a simple basic oxygen is heart-wrenching to see. It's really troublesome to see the numbers that went up between March, April, and at the current time in May. We hopefully the peak has happened. I can't really even fathom to see that number, that curve still going up. It's really sad. What does it entail for us? The world is a very small globe right now. It's not flat anymore. It's so close. There's significant globalization everywhere. There's travel every time. And with that comes along the passage of this particular virus from one end of the world to the other end of the world with an ease. And then if you start having mutants that are going to be developing in different parts of the world, we can expect more waves to come through. We already have seen a couple of the Indian mutants here in the US, and we really need to get them very well quarantined off, very well contact traced, so that we can hopefully keep them in silos and not allow it to progress. But that's the fear, that what if we get away with the same kind of mutants where we may not have as much efficacy as we would want it to be.
Yes, for sure. India is the second most populous nation in the world. I can only imagine the implications of this if it's not contained. My last question to you is, Doctor, I'd love for you to give us a prediction for the next month or two for United States and also what you're thinking about India.
That's hard to say, but looking at the curve that we have today, I think that that downward trend we love. And we hope that it'll continue going forward this way. The numbers have remarkably come down these past 2 weeks. And, it's nice to see, there's no new admissions for COVID. That would be awesome. But yes, they are going down, and we hope that it's going to stay this way in the upcoming few months. Regarding India, as I mentioned, I think there are a couple cities in different parts where they have been able to have a little bit better handle, but nowhere is it coming down as yet. So we're still talking about yet another few weeks for this acute peak to drop down.